Good morning, everyone. Today I'm going to present a case about 17 months old child. He presented to our hospital with acute right medial canthal area swelling and erythema. But the previous history of this patient, he has nasolacrimal duct obstruction and he underwent syringing and probing with intubation and other facility. And the procedure was uneventful. So 1 week after the procedure, the mother noticed that there is an edema and swelling with yellowish discharge. This is the clinical picture of the patient. As you can see, the swelling and edema. So, and those are some images, CT scan. As you can see, opacification of the area of nasolacrimal duct. So our differential diagnosis at this stage was orbital cellulitis due mainly to dacryocystitis, and the tumor was also on the list. We admitted the patient under pediatric team for further investigation. ENT and ID was consulted, and he was started on triple IV antibiotic based on ID recommendation. After that, the patient did not show much improvement in his condition, so ENT team started him on a small dose of oral steroid. After 3 days, the edema subsided and there is a mass, palpable mass, appeared on the medial canthus area. So the plan was to order MRI, and the MRI showed there is a mass, and the biopsy was scheduled. So here's the biopsy, as you can see, and we removed the nasolacrimal tube, the silicone tube. After that, the pathology, at this time, we sent part of the pathology for frozen section also, and malignancy was ruled out. So as you can see in the pathology section, the first picture showing granuloma and inflammation. The second one, Gamsa stain showing, Gomori stain showing broad non-septate hyphae, and the periodic acid sheaf showing acutely angulated non-septated hyphae. So the diagnosis was mucormycosis and aspergillosis. So the plan was to start IV amphotericin B and to do surgical debridement for the patient. This is his MRI. You can see how huge is the mass. And this is the surgical incision that was done for this patient. So the patient improved and has no recurrence after that, but the take-home messages of this case is to take thorough history, because the mother was saying there is a mass, but no one paid attention to that. Also, palpation is something important. Even if the patient has like swelling, edema, tenderness, just palpate. The patient was afebrile, doing well, active eating, which goes against orbital cellulitis. In those cases, multidisciplinary team is essential.
Time is over. Thank you.
Okay, that's it.
Thank you.
Just one question for the panel. When should we start steroid for orbital cellulitis cases, or should we start steroid?
That is another question we can answer. But a couple of things which you mentioned here is that the mother was saying that I think it's a mass and it's not infection, she was saying. The another things, do you have the surgical pictures to show?
This
if
one?
You have? No, the surgery itself, how much it was opened. And
No.
No, it's not. Okay, anyway. This face was opened completely, and because Dr. Fatma and myself, we were not convinced that this is aspergillosis. We always thought this is a secondary infection and it is rhabdomyosarcoma because it was coming from the muscle. So the debridement included the inferior oblique muscle as well. We just completely removed the inferior oblique muscle. You have beautiful pictures of that, but I know you have time. So we were never convinced this is an infection or it's a secondary infection. So this is, I think, from a surgical point of view, the reason why we're thinking that is aspergillosis, and it was mainly aspergillosis in a young, healthy, completely healthy patient is unheard of. Okay, it is unheard of. And it was a very slow progressive. So we always thought that it must be a tumor. It must be a tumor. So, and it must be, therefore we had to remove the inferior oblique muscle. Yes.
Could it have been seeded by the procedure that was done previously?
That's an excellent, I wanted waiting for this. Yeah, we think it was that. Yeah, we think. That's the only explanation. Because when you removed, I don't know if it was clear, Fatima, there was a black silk suture there as well, which we never do that, you know.
Was that a Crawford?
The tube.
Oh, it wasn't, it was from another.
Was it a Crawford?
Was it a yeah, I think it was a Crawford.
But
Yeah.
they're usually pretty harmless, pretty benign. In fact, many of them end up, the kids pull them out. That's the problem. They come into you with them hanging out of their tear duct system, and you have to take them out.
Thank you.
Thank you.
Thank you.
Yeah.
Next, please.